And we're back. Welcome back to iBreak. Today we're talking about glaucoma. As you can see, there was some peripheral vision loss in our little camera here. We're high production quality here at Armstrong and Small Eye Care Center. Today we're back with iBreak. I'm Dr. Luke Small.
Dr. Matt LePage.
Today we're going to be talking about glaucoma. This is a massive topic, and we see right away that we've got a question from a super fan in Melbourne, Australia, named Jack Foster. And Jack wants to know, apparently, he reckons, is he going to be getting glaucoma since his mom has it?
He certainly, in that case, would have a higher risk of developing it. Not guaranteed, but yes, family history does give you a higher risk of developing in the future. What is glaucoma?
Great question, and a difficult one sometimes to answer, but basically, imagine if there's too much pressure in your eye. No matter what that pressure might be, is it too much for the walls, and particularly the optic nerve at the back of your eye? It's the part that actually transmits the signals back and forth to our brains. And if there's too much pressure right in at that optic nerve, it can damage that nerve. The only way to pick up that damage is to look inside your eye. The biggest issue with glaucoma, there are no symptoms.
Nicknamed the silent thief of sight because of that. Watching TV, driving, faces, reading, unaffected until very end-stage disease. You just slowly lose your peripheral vision over the course of decades, and it is super sneaky. So you need an eye care professional to diagnose and treat it effectively.
So this is one of the things when other practitioners ask Matt and I, why do we screen or why do we need to look at the eye as often as we do? You're not going to have your kidney checked, your liver checked almost annually every 2 years, but with the eye there's a lot of diseases, and glaucoma is the big one as to why people can have totally symptomless, can have 20/20 vision and absolutely still have glaucoma. It takes some sensitive instruments to be able to pick this up and to ideally catch it early. There are two types, well, I shouldn't say that. There's two main types, and then there are a ton of subtypes. We're really going to stick to the one main type today, which is called primary open angle glaucoma. There's also closed angle. Watch for our other video, and you'll be able to see that. We'll talk about that and some of the treatments with that in another video. But today, the key factor is this is one of those things, why should you see your optometrist? And glaucoma should be a big one. How often do we get patients? In fact, we had one this week that says, I don't want the puff of air test. I don't have glaucoma. There's no way that she can know that.
Absolutely not. No, exactly. So yeah, young healthy adults typically we'd ideally like to see every 2 years. For our glaucoma patients, we see them much more frequently, every 6 months, sometimes even more frequently, 3 or 4 months initially, to monitor for disease progression and to make sure we have that pressure down where it needs to be, which
is the key factor in glaucoma. If we can lower the pressure, then we're going to avoid further damage. So the biggest thing is when someone comes in for their eye exam, a few things that we're screening for. So we're going to run an IOP test, that's your intraocular pressure. How much pressure is in your eye? There's a couple ways that we can do that. The infamous puff of air where we blast you. Blast is a strong word. But we have other ways of measuring that pressure. We also run...
we have the eye care tonometer, which is... Oh, is that what you're talking about?
Yeah,
the pressure measurement?
Sure.
So that's
we have
one of the more... Let's talk pressure for a second. So we've got the eye care, a much less, let's see, shocking form of pressure measurement.
Less invasive.
Sure, I like
invasive.
Invasive, I think is right. I like that. But sorry, what you're actually trying to get to, other screening methods. So we have our FDT frequency doubling
technology.
Thank you.
Yeah.
Visual field, basically screening visual field to monitor for early visual field defects.
For those of you who have done this test, you look at a small little screen, there's almost like the screen is moving, flickering back and forth. That flicker frequency actually goes back to the optic nerve in order to detect it. The first cells that are affected in glaucoma can actually start to miss that flicker frequency. So that's an important test, and we run that on almost all of our patients. Maybe little kids that we don't, but most of the time we're trying to pick up that glaucoma disease early. Now, so once we've screened out the patients that we deem are probably a little higher risk for glaucoma, we're going to bring them back here at Armstrong and Small Eye Care Center. We call that a glaucoma risk assessment. Essentially, we're doing a more in-depth set of testing, specifically looking for signs of glaucoma. Some of those things would be?
Visual
we're
field
measuring
loss,
when they come in.
So you're looking at your corneal thickness, the retinal nerve fiber layer, the ganglion cell layer, different layers of the retina become damaged with glaucoma, fields, the angles of the eye. There's a pretty long list of things we're monitoring with glaucoma.
And if you go back to when my dad used to do this, it was all about pressure. If you had high pressure, off you went to the specialist. We look at a ton of variables now. It's actually a lot to go into. So there's a ton of stuff, obviously, that we have to go over, and we're trying to review everything with that patient to explain, really, do we think that glaucoma is there or not? And sometimes it's not always cut and dry. It can be difficult to tell. You can see 10 of us, and we might all have a little bit different. You know, some of them are very definite, other ones not. So we're always trying to catch that early. So one of the questions that also comes up is the treatment. What's the protocol? Well, the whole basis of treatment is trying to lower your pressure to preserve the look and the health of your optic nerve so that it doesn't get further damaged. Our job as optometrists and whoever's treating glaucoma is to try and preserve your visual field so that it doesn't get any worse or ever get damaged. And we do that by the means of drops. That's probably our main thing.
Mainstay treatment, yeah. So we'd start you on an eye drop if deemed necessary to lower the eye pressure and monitor for future change. If your visual field or OCT are continuing to change, adding another drop, certain laser procedures can be used, as well a multitude of different glaucoma surgeries available nowadays, which we would then consult with a glaucoma specialist, an ophthalmologist, if that were necessary. But lots of treatment options available. However, early detection is paramount.
If there's any reason to have an eye exam, to see your optometrist early and to do it on a routine basis, it's glaucoma. So thanks again for joining us today, and don't forget, be wise.
Take care of your eyes.